Hello all, welcome to the first content video after the overview. I have again a number of other topics we'll be covering in the future. This one I placed first, even though it's kind of out of sequence, just because I have no idea when someone might be having surgery, and I thought this might be the first topic would be helpful. So in any event, this is a series of videos that are paired with a book I've recently written. It's entitled A Proactive Approach to Knee Replacement, and it's a data-driven guide to reduce complications and increase the odds of optimal outcome. It's published in October of 2025 on an ebook format, which I favor because of the hyperlinks. I think make it a little easier to read and move to some of the exercise videos and internal content. It's available on Kindle, Apple, Barnes & Noble, and published by BookBaby. So I'd encourage you to pursue the book if you're considering knee replacement at any time in the future. So back to this topic, what prompted me to do this segment was I got a call from a physician friend of mine the day before she was about to have a hip replacement. She's a non-surgeon. She was nervous. Everyone is nervous. I was nervous. I have had 2 knee replacements and hip replacement. And so I'm familiar with it from both sides. Even though I've performed many thousands of these surgeries, basically spent half of my career in the operating room, there's still some apprehension even for me. So I thought this would be a good topic to move forward on. And I think even though apprehension and anxiety is universally present, it is modifiable through knowledge and education. So that's the purpose of this talk. So again, surgery is an emotional event, and it doesn't matter whether you are a surgeon or not, whether you're a physician or not, everyone has apprehension. I think the apprehension, it breaks down in a couple different categories, which I'll segment here. But the first comment I have is that it is completely normal. It's extremely abnormal not to be nervous. Some people are nervous enough that they refuse to sign up for surgery. I've seen people that obviously dramatically needed surgery for all sorts of reasons, and they're too afraid to step forward. Many of those people, if you talk them through it, are able to get over that hump, but some are not. But like all things, there's risk in everything you do in life. There's risk to do surgery, there's risk to not do surgery. People get worse. You become more debilitated. So surgery is appropriate at a certain level of disease for almost every patient, unless they have too many medical issues to make it reasonable. So moving onwards, we can call this apprehension, we can call this anxiety, we can call this fear. There's a couple aspects of this, I think, as I contemplated it during my discussion with my friend and during my own experiences. If you're not familiar with the process, that can be anxiety provoking. And then I think the topic that everyone has, and this was really my issue, was loss of control. Many of us like to control as much as we can in our life. There's some people that don't emphasize that. Surgeons are control freaks. We want to control everything that goes on in the operating room because we want to minimize the chances of things going wrong. So we want to make sure we have good staff, that they're paying attention, that all the instruments are available, that we have backup things. If something does go wrong, we know that we have the equipment to deal with it. So as a surgeon undergoing surgery, obviously I'm going to be under anesthesia and I'm not going to be able to control anything. I'm going to have a drape over my face, be asleep, whatever. So I think on loss of control, probably the most important thing is to have a lot of faith in your surgeon, that not only are they very competent and good at this procedure, but they also are a caring person and really want the best for you. So I address kind of in the book a little bit about surgeon selection. I think a surgeon that does a lot of volume, you can have a lot more faith in because they know what can go wrong and how to get out of any problems. And they have a lot of experience with this. And then secondly, again, I think you want to go to someone that you have a personal connection to, because that makes it, I think, much easier to trust them. And you do need to trust your surgeon. You need to have faith. The next segment of apprehension, I think, has to do with the fact that the operating room isn't a familiar environment for most patients. That wasn't true for me, and isn't true for surgeons, but it's true for pretty much everybody else. They don't really know what to expect. So there's two things to talk about here. One, I think, is to walk through the process so that you kind of know what to expect and you can kind of focus on these steps to get through it. So number one, obviously, the morning of surgery, you'll have been informed what time to get to the hospital or a surgery center, and you want to get there on time. You obviously want to be NPO. Don't have a donut right before surgery or a cup of coffee, or you're not having surgery. You go to the registration area. You need your wallet. You need your insurance information and ID. You need to bring with you loose clothing. Loose clothing is important. A change of clothing is important. I chose like the snap basketball kind of warm-up outfit for my legs, so that those could be the snaps could be undone. They're easy to put on and off. Easy to put on over a dressing. You don't want anything tight. You can wear shorts, but if it's cool outside, you might want to choose something like I did. And you want a t-shirt, change of clothes, easy to put on and off shoes, something you can slip on. People have to help you dress afterwards. And then if they have you bring any equipment, you want to bring that. After registration, you have a short wait, hopefully a short wait, and then you go off to recovery, or to pre-op, excuse me. In the pre-op area, you'll meet a nurse. She'll kind of talk you through things. You will get an IV started. You will take your clothes off and put on a gown. They will shave your leg at the surgical site. It's very important you don't shave your leg ahead of time for at least 5 to 7 days, because you don't want any small cuts on your surgical site, as that can lead to increased infection. They will also do an initial prep or wipe down. You want to make sure you don't have any lotions or creams on, because that can interfere with the prep. And as part of many of our protocols, even starting 3 days before surgery, we start showering with something called Hibiclens, or a different antibacterial chemical soap to try to decolonize or reduce the number of bacteria on the skin. Each time the leg is prepped, there's a further reduction in the number of bacteria. And if you start with a lower number, you end with an even lower number, and that is to your benefit. Next, your anesthesiologist will come talk to you about anesthesia. Regional anesthesia is the preferred technique, so don't discourage that. That would be a spinal and or a regional block. They are excellent for pain control, very safe. Strongly encourage you to move along with the anesthesiologist's recommendation. Next, you'll speak with your surgeon. They'll say hi, mark your surgical site to make sure you're getting the right knee done, which is repeated several times in this process. You'll sign your consent. Usually you'll get a little medicine, and you may not remember anything after that. You're wheeled off to the operating room, and then time seems to vanish, and the next thing you know, you're in recovery, waking up, and it's like you don't have no idea that actually surgery happened. So that's kind of the sequence of events you'll go through. There's some variance on the order of those things, but those things generally happen every time you're going to have an operation. So I think you can focus on that, and some of the things preparing for surgery will help with anxiety. So here we are again. Don't shave the leg for at least 5 days. Shower ahead of time. Don't use lotions. pack your bag. Almost all patients will get a call the weekday before surgery with instructions like arrival time, what to bring. Do be on time. Do not eat or drink anything after midnight, such as coffee or donuts. Donuts seem to be a preference for patients pre-surgically. Sometimes you can drink clear liquids after up to 4 hours ahead of surgery. If so, go ahead. It is important to hydrate very well the day before surgery. And then a couple advices on diet, which again are emphasized in the book, but we'll talk about it here if you're not having surgery tomorrow. We want to consume a lot of protein before and after surgery. Low protein levels are associated with more wound problems and infections. So we want a protein load. Our protein requirements after surgery are dramatically increased from baseline. It's kind of like running a big race, like a marathon. And as far as starch and carbs, it's kind of the opposite. Surgery is going to raise the level of blood sugar in all patients, whether you're a diabetic or not. And that's from the stress of surgery, and most patients also receive some steroids during surgery, which help with pain, nausea, and other immediate perioperative issues, which further elevate blood sugar. So even non-diabetics, we would like to taper starch to a lower level, maybe down to around 60 grams of carbohydrate a day in a non-diabetic. If you're on insulin, you have to speak with your physician about what's a safe level to get down to. But if we don't have a lot of starch in our system before surgery, we'll have less of a blood sugar raised right after surgery. And I would encourage you right after surgery, do not drink a sugared drink like juice or a Coke. In the recovery room, choose something without sugar to hydrate with, and keep that up for the first 24 hours. I generally recommend a low carbohydrate diet right after surgery. I would be very bothered by sometimes rounding after surgery when patients were in the hospital overnight, and I'd see them eating cookies and candy and cake right after surgery, or a lot of French fries. All those things are really detrimental and lead to more wound and infection problems. So be aware of that ahead of time. Eat a lot of protein, watch your carbs, and you'll do yourself a favor. So again, I'd encourage you to reach out for my book, A Proactive Approach to Knee Replacement by Dr. David Graybill. Again, the e-format I think is favorable for most patients, although the print one does have advantages. You can underline, etc. We'll move onwards to some more topics with the next video, and I hope you all have a great day. Thanks again.